What sets your company apart, and what do you do differently that gives you confidence in winning?
My name is Mikkel Lewis. I lead our strategy at Pack Health. And Pack Health is a digital engagement platform. We're really focused on behavior change for chronic conditions like type 2 diabetes, for example. And in our Better Food for Better Health program, we're focused not only on adherence to healthy foods, but also everything that comes before that: accessibility, affordability. And, when we think about it and we break down the behaviors related to healthy eating, it goes from purchasing to preparing to portion controlling. There's a lot of elements in there that make that really complex. So we partner patients one-on-one with a health coach to create a meaningful relationship that can help guide the patient to those healthy behaviors. And I do think we should win because we do have proven published results that we're excited to talk more about.
You guys are part of Quest. We all know Quest. So I want to hear about the Pack Health solution. But again, tell me about some case studies. Why are you guys doing this? And why is Quest in this business? And why was it really important for Quest to do this?
So I'm going to start with the Quest piece just to kind of hit that. Quest saw Pack Health as a vertical integration. So one thing that we are focused on is continuing to innovate on our products. And so I think a competitive advantage we have is that Quest does have 1 in 3 data points on Americans. So how can we take that lab clinical data and then take action on it? So Pack Health is considered a beyond the lab service that Quest is expanding on all the time. And to get back to the case study piece, Pack Health, actually prior to the acquisition, did complete a case study with Blue Cross of North Carolina, which was published last March in the New England Journal of Medicine, where we had over 880 participants in a large 6-month pilot focused on those managing type 2 that were identified as potentially food or nutrition insecure. Through that work, we collected a lot of patient-reported outcomes and saw some decreases in BMI, along with increases in mental health and other pieces like that. But I think the big point is that we did see those that participated in the program had about $139 per member per month reduction in total medical cost. And if you extrapolate that out based on the analysis that we did, we expected that to even be a potential reduction of about $8.5 to $13.1 million annually for that plan. So again, something that we are continuing to innovate on through partnerships and getting more clinically aligned is how can we continue to bring these proven results to the market.
Give me a case study. Give me an example where basically Pack Health basically transformed. Maybe it was a typical Quest customer who didn't realize it. Basically, all this was available to them. Blow us away.
So another case study I would mention is that, a lot of times, Josh brought up a great point that one thing that I wish we would have a better hold on is the household impact that it can take when you deliver a box of food or you deliver or get a delivery of food sent to somebody. And so I'll never forget this. We had a member in one of our case studies that had mentioned, I don't know what I was going to do to find my next meal if I hadn't have known about this program. And it came through my insurance company. But I don't think you understand the impact beyond just myself. I mean, it was a family of 4. And so that's something that's always stuck with me is essentially this person was able to leverage their resources through their insurance. That was a Pack Health guided program to understand, how to use the food and just, have access to something that they wouldn't have had access to in the end of the day.